Hey everybody, so I'm going to talk today about acid reflux and particularly how acid reflux affects the throat rather than the chest and the typical stomach and heartburn that people think that reflux causes. So I see a lot of patients with this particular problem, and basically what happens is, with any acid reflux, you're having stuff that should stay down in your stomach and it's going backwards up the esophagus and potentially into the throat or even up into the sinuses and the ears. So if that stomach acid and contents rises up and mainly stops in your chest, that's where people get typical reflux symptoms like heartburn, burping, and just that sort of discomfort that people get. However, if that reflux keeps going and it comes up into your throat, people tend to develop throat symptoms. And while they still may have some heartburn, it tends to be less when people are having throat symptoms. So, what are the typical symptoms of throat reflux? So, the most common associated symptom is something we call globus sensation. And basically, that's just the feeling like something's sitting in your throat all the time, whether it's a lump or a tickle or feeling like a pressure sensation. Other common symptoms that are associated with throat reflux are difficulty swallowing, particularly taking extra effort to get, pills or pieces of meat or other things that are sort of dry and solid. It takes some extra effort to get those down. Another common symptom would be hoarseness of the voice, and this usually fluctuates. It tends to be worst early in the morning, right after getting up, but it sometimes can get worse throughout the day as well. And the fourth common symptom with this is clearing the throat all the time, feeling like there's mucus back there and you just can't get it out. So there are other less common symptoms, but those are kind of the main symptoms of throat reflux. So what I typically prescribe to treat this problem would be an acid-reducing medication like Prilosec or Nexium. But the best long-term treatment for this is actually changes to your diet. Medications for reflux don't actually stop reflux. They just turn down the level of acid in the stomach, but they don't actually stop anything from coming backwards out of your stomach. So the best way to do that is to make changes to your diet. And I'm going to drop a book recommendation for you here. This book called Dropping Acid by Dr. Jamie Kaufman. You can buy this on Amazon for under $20. It's a great resource. Dr. Kaufman is probably one of the world's experts in this problem and actually discovered throat reflux. And she has a lot of great teaching about the problem, but more importantly, she actually gives you a diet plan to make this problem better. So the way it works is you'll sort of cleanse all the bad things out of your diet for a few weeks, and then over the next few months, you'll start experimenting and adding foods back into your diet until you know what triggers your symptoms and what doesn't. And that way you'll have a lifelong ability to help control this problem. So anyway, again, I hope that's helpful for you, and I'll see you in the next video.